Thank you all for having me here tonight. I really appreciate it. And thanks to everyone from the public who's attending tonight. So tonight we're going to be discussing a portion of my dissertation research. As we were mentioned, this presentation is called Inoculating Whiteness, Settler Colonialism, Whiteness, and Infectious Diseases in Sitka. And before I go further, I just want to note that some of the content of this talk is distressing and deals with attempted genocide, medical experimentation, and boarding schools. Please prioritize your health during this presentation. If you need to step away at any time, please do so. So tonight, I'm just going to be quickly just telling you a little bit about me, how I approach this research project. I'll talk about this concept of inoculating whiteness, what I mean by it, and kind of how it changes over time. And then I'll talk about how this relationship between race, settler colonialism, and vaccines has really changed over the past 200 years, taking one form during Russian settler colonialism, taking another form once Euro-Americans committed settler colonialism in the same place. And we'll also discuss sort of how inoculating whiteness and how these histories of settler colonialism emerged during the COVID-19 pandemic. So Vera did a fantastic introduction. Most of this you've already heard, but just quickly again, my name is Adam, Jewish American researcher. When I was in Alaska, I was told a lot of times to introduce yourself by saying where your family's from. My family came to the US from Serbia, Romania, Lithuania, Poland, England, and Germany. And presenting on a topic like this, it's incredibly important for me to recognize the fact that as a white person, I have benefited from settler colonial genocide. So the systems that I'm about to critique and discuss are things that I have benefited from as a white person. I'm neurodiverse. As Vera mentioned, did my master's in anthropology at University of Central Florida, research on asylum seekers and refugees' access to healthcare and legal services, and did my PhD at the University of California, Davis. I've retained a medical anthropology focus throughout this. So first, I want to sort of contextualize where we are just geographically. So this is a map of so-called Alaska, highlighting where different indigenous peoples and languages are in different places. So we are going to be talking today about this gold portion on sort of the lower right, sort of, where it says Tlingit. And this is the homeland of the Tlingit people. Specifically within traditional Tlingit country, I'm going to be discussing Sitka. You can see here it's circled with this arrow pointing into it. Tlingit territory is traditionally divided into these kind of geopolitical units called clans, which can mean a number of things, but for the purposes of this, it kind of means homeland. So the full name for Sitka is Shi-at-ika Kwan, which means homeland on the outside edge of a branch. A very evocative name that you can easily picture looking at this set of islands that's just right on the edge of the Pacific there. When you look out into the ocean from Sitka, it's just thousands of miles of ocean. So Sitka was established after the Kiksadi Tlingit. Were looking for a place to settle as they were traveling down the islands of Southeast Alaska. And as they were coming up around the bottom of an island, they saw a light in the distance. And they followed that light to find a place where they were going to create their new homeland. And that light was the light of this volcano. In Tlingit, it's known as Tluch. In English, it's called Mount Edgecombe. And this is a volcano that's right across from Sitka. You can see it from downtown on clear days. And it's just on a neighboring island. Doesn't really cause any problems for people today. Occasionally there's an earthquake, something like that, but it's mostly a dormant volcano. I think technically it might not be dormant, but I'm not a geologist. So Sitka has traditionally, since time immemorial, been an important gathering place for Tlingit people in Southeast Alaska, particularly during the spring. Every spring around, I mean, I guess it kind of depends on the year, but more or less sometime in April, the herring come to the area to start laying their eggs. And Tlingit people will take large branches of hemlock trees, dip them into the water. The herring will swim by and lay their eggs on the branches. People pull the branches up from the water, and the branches are just absolutely covered in fish eggs. And it's a really important seasonal food that marks the coming of spring every year. And this is something that, again, Tlingit people have been doing since time immemorial. And even in all of the Tlingit homeland, Sitka has always been special for being the biggest gathering place for herring every year. So every year when people are wanting to get a taste of this food that brings in the new season, they head to Sitka. It's been that way in the past, and it's still that way today. Sitka is a part of what's called the Tongass, which is the largest temperate rainforest in the world. It's an absolutely beautiful place. It's probably the most beautiful place I'll ever live. Incredibly dense and thick rainforest. And once you start to get a little bit more familiar with the rainforest, one of the really fun things is while you're hiking or something, you can just kind of snack the whole way. There's berries everywhere. There's leaves. There's just all of these things growing in the forest that you can, again, just kind of like snack on while you're hiking. It's really fantastic. So in about 1799, Russian colonizers came to Sitka. So Russian colonizers had really been moving across the entirety of Siberia. As they're moving across Siberia, they're essentially, in many cases, kidnapping men from various indigenous groups while holding their families hostage and forcing those indigenous people to hunt for furs. The furs were entirely used basically for the Russian royal family, for imperial Russian coffers. And this was a practice that, again, they had been doing the entire time they were moving across Siberia. Once they crossed the Bering Strait and came to Alaska, they started at the Aleutian Islands, which are just those little islands that kind of trickle off of the state into the southwest. The Russians encountered Unangach people, and Russians did the same thing that they had been doing while moving across Siberia. They enslaved Unangach men and held their families hostage, telling them to get as many sea otter pelts as possible. At this time, sea otter pelts were the most valuable fur in the world that you could have. And so, as Russians were moving down the Alaska coast and finally came to Southeast Alaska, when they came, they brought enslaved Unangach men with them. And so again, Russian colonizers arrived in 1799. There was like obviously trade and things between the Russians and the Tlingit, but there were also repeated abuses of trust, repeated violations, repeated acts of violence against Tlingit people on the part of the Russians. And so in 1802, the Kiksadi successfully repelled the Russians. It's this really fantastic battle, which is not something I really say often or easily. But one of the most famous images that comes from this battle is a Kiksadi chief whose name was Katlion, who used a blacksmith's hammer in the battle to help repel the Russians. Unfortunately, in 1804, the Imperial Russian Navy returned, and despite the Kiksadi's ingenuity, the Kiksadi had to flee across the island on a dangerous march. Some elders I spoke with compared this to the Cherokee Trail of Tears. But what I really want to spend a second highlighting is, again, the ingenuity of the Kiksadi. The fort that they used when they were fighting the Russians in this last stand was called a Greenwood Fort because it was built from all younger trees, so that when the Russians fired cannons and the cannonballs hit the fort, the trees would bend back and throw them away, so that the fort wasn't severely damaged by cannonballs. Also, there are some primary sources at this time that talk about Tlingit armor, the armor they were wearing at the time, being able to repel musket fire to some extent. So again, really want to highlight the ingenuity of the Kiksadi in repelling the Russians. And so I just want to talk a little bit about how I'm approaching research, how I approach this place. Again, Sitka is the home of the Kiksadi clan. And when I originally went to Southeast Alaska in 2018, and I really wanted to do a project that was on climate change, specifically looking at sort of the ways that climate change is impacting people's mental health, broadly understood. But while I was there, I started to hear a lot about herring fishing, which I've mentioned a little bit so far, and became really interested in this. I started to hear about commercial fishing that was really threatening Tlingit folks' ability to continue to harvest the herring every year, to continue to harvest the herring eggs. Again, there still continues to be a very aggressive and wasteful commercial fishing process. To sort of give you an idea, again, I mentioned when Tlingit people harvest herring eggs, they're just pulling these branches out of the water that are covered in eggs. The commercial fishery, which is also trying to get herring eggs, just throws nets in the water and catch fish and basically take only the eggs and discard the rest of the fish dead. So the commercial fishery is incredibly wasteful. And when I was having conversations with people about the herring fishing, people were making a lot of comments about relationship between race and different approaches to fishing. So I was originally wanting to do a project that was looking at the relationship between race and commercial fishing and subsistence fishing. I received approval from Sitka Tribe of Alaska's Tribal Council to do this research, and then the pandemic hit. That research project was no longer possible. That research project would involved me spending a lot of time on fishing boats, which is something that I didn't feel safe or comfortable doing. And frankly, I didn't want to do something that would even present the possibility that I, as a researcher, could spread harm to folks that I was working with. So I wanted to come up with a research project that would be immediately useful to Sitka Tribe of Alaska and something that would be able to really give back to the community. I mentioned that my research before this was in medical anthropology, looking at healthcare access for asylum seekers. So medical anthropology was something that was really familiar to me. And actually, I started reading a little bit about what some anthropologists had wrote about infectious diseases in Sitka. And to be honest, what I found was really upsetting and made me pretty frustrated. It made me feel like the way that anthropologists had discussed infectious diseases up until this point had really just been repeating a lot of these settler colonial tropes, making a lot of assumptions about people's supposed superiority or inferiority, or in some cases, repeating the claims of sources that were coming from settler colonizers without really critically thinking about what the person is saying, why they might be saying it. So I reached out to Sitka Tribe of Alaska's Tribal Council, asked permission to shift my project, and said, I want to conduct this project, look at vaccine hesitancy with the COVID pandemic coming in, and I want to basically understand how settler colonialism is manifesting during the COVID-19 pandemic. Tribal Council granted me approval. We're very excited to hear reports on vaccine hesitancy. As Vera mentioned, into the pandemic, this was, I think, November, December 2020. I had been speaking with tribal citizens and also non-Indigenous folks in Sitka, and had been just hearing like how many folks were ready to basically go and immediately get vaccinated as soon as it was available, versus folks who said they wanted to wait a while, or even folks who said, no, there's no way I'm going to get vaccinated. So I was able to provide that report to Sitka Tribe of Alaska. And of course, once my research was finished, I provided another report to them summarizing my research. And I'm also obligated to say that my research was funded by the Wintergren Foundation. This picture to the right here is, I was actually incredibly lucky and incredibly honored to be able to participate in the herring egg harvest in the spring of 2021. And this is a picture that I took while I was out there. And this is just a picture that really captures the beauty of the place, because it's just dotted islands just as far as you can see, unless you're just looking at open ocean, just full of like thick trees. When you even get up to the shore of these places, there's just so much life in the tide pools. It's just an incredibly beautiful place. So before I get too much into the actual like content of my research, I wanted to provide a little bit of background information. And so to do this, and since this project deals with race, I'm going to briefly kind of go over a critical history of race. So a lot of times today, the way that we are told to think about the world, we think of race as being this concept that has kind of always existed, that people have always understood difference through this racial lens that we understand it today. But that's actually not the case. Um, Before the idea of race came about in the mid 1800s, Europeans had been understanding themselves as different from, and frankly, they understood themselves as superior to other people through lenses of culture, civilization, and religion. For instance, saying people were inferior because they hadn't accepted Christ or something to that effect. Or people were inferior because of cultural differences, differences in cultural practices. But in the mid 1800s, biological anthropologists and biologists and other folks working in sort of evolutionary biology fields started to come up with what would become the ideas for race that we understand them today. These scientists applied now debunked methods, now debunked arguments that basically applied biological language to existing social inequality. And so at this time, they started to articulate this difference not as cultural differences, but as biological differences. That differences between people and Europeans, one of my advisors uses this phrase that I love, self-assumed superiority. European self-assumed superiority went from them thinking they were just culturally superior to people to thinking they were inherently biologically superior. And this is, again, when we start to see the language of race come into existence. It's also important to note that racial categories, as we know them in the United States, have no corresponding biological reality. So race biologically doesn't exist. Ancestry is something that you can sort of use to group peoples, but that's a separate concept from race. But again, there's no biological basis for racial categories as we understand them. However, that doesn't mean that race isn't real, and that doesn't mean that race doesn't have a really profound effect on people's lives, the types of lives they can live, the experiences they have day to day. And so, within the social sciences and humanities, we say that race is a social reality with biological consequences because the discrimination that folks experience in society has physical effects on your body. Scholars who study race have pointed to the fact that also race isn't really just about, isn't exclusively about skin color. Ideas about race also include ideas about culture, education, language. And so, again, this is just to say that race is more complex than just skin color. Another insight that's come from scholars looking at race is that race is what's called a floating signifier. And what this basically means is that race means different things in different times and different places. So folks who are considered white today might not have been considered white 100 years ago. And one example that one of my professors like to use, she's Peruvian. And when she is in Peru, she is considered white. But when she comes to the US, she's considered like Latina. She's considered a woman of color. And obviously, there's nothing that physically changes in her body as she flies from Peru to the United States. It's just very different cultural contexts. And so, again, this is really just to point out that race isn't this sort of like static, monolithic thing that we're often told to think of it as. And so, one of the things that race does as a concept is race creates ideas of difference, of how people should be categorized and why people are distinct from one another. So, the idea of race marks populations as separate from each other. And then when disciplines such as, like, we can say medicine or even statistics, we can even talk about things like the census, where they ask you to record your race. All of these things solidify the notion of these different notions of difference. And these acts are really actively kind of creating these populations because they are constantly treating them as if they're separate populations. And so this presentation is concerned with whiteness. That was the main focus of my dissertation. And so I want to kind of define whiteness briefly, talk about what I mean when I say it. So there's kind of two ways in academia of approaching whiteness. One is either approaching whiteness as referring to like the behaviors and characteristics that mark a person as white, is more like looking at day to day when a white person is interacting with other folks. What is it that that white person says, does, that marks that person as white in other people's perspective? Another way of looking at whiteness in academia is looking at more as like a structural or systemic force, and really this tool for creating an abstract racialized other, while simultaneously granting white people an inherent right to land, bodies, and resources. And obviously that's what we see with the colonization of the Americas, right? Was Europeans coming here and just saying they inherently have a right to this land over people who have lived here since time immemorial. And so this sort of systemic perspective of whiteness is what creates and justifies white supremacy. And so in this presentation, I'm going to be doing a little bit of both of these things, but I'm mostly going to be doing the second one, mostly to pay attention to how whiteness is used as a tool for marking difference between different populations. And so, in the title of this presentation, I have Inoculating Whiteness. I guess every academic has to coin some sort of term. So here we are. But I am understanding inoculating whiteness as a conceptual tool to help understand the relationship between infectious diseases, settler colonialism, and race. And so inoculation, obviously, is the process of injecting a weakening form of some kind of infectious agent into a person's body in order to respond to the presence, not the present, excuse me, the presence of that agent. So when someone receives a vaccine, they receive, in some cases, a weakened form of the virus to teach their body how to respond to an infection if they get, or if the virus tries to infect them. And when people talk about inoculation, we can say that people are either inoculated with a specific vaccine, or we can also say that people are inoculated against particular diseases. So what I'm going to argue in this presentation is that colonizers saw vaccines in Sitka as inoculating Tlingit people with whiteness, as introducing a material form of supposedly superior European and white technology that would again facilitate Tlingit people's acceptance of colonial rule. But at the same time, these vaccines were only necessary because of settler colonialism, right? Had Europeans not been coming to these places and spreading diseases like tuberculosis, smallpox, influenza, these vaccines wouldn't have been necessary. And so to some extent, these vaccines were necessary to inoculate against whiteness, to inoculate against the settler colonial justification for coming to a place and taking someone's land. And so I'm going to use this again to kind of refer to, in a way to understand this dynamic relationship between vaccines, infectious diseases, and whiteness. So, as I mentioned, Russian invaders came to Sitka in 1799, continuing the practices of Russian settler colonialism that Russia had used, expanding across the entirety of the continent and then coming into Alaska. When Russians first arrived in Sitka, when they write about the difference between themselves and Tlingit people, first they are describing this difference in more cultural terms, like saying the Russians, of course, are thinking of themselves as superior. And they're writing that they're superior to Tlingit people because of their behaviors, because of their practices. But by about the 1850s, when racial pseudoscience starts to become a big force in international science, they start to describe this difference between themselves as more due to blood and breed. And so it's not so much about the things that a person does, but again, is just what that person inherently is. So, one of the main colonial agents in Alaska was a Russian Orthodox priest named Ioan Veniaminov, who later in the Russian Orthodox Church is canonized as Saint Innocent. He wrote about a smallpox epidemic that was occurring in 1835 and 1836 that killed roughly half of the Tlingit people in Sitka. It's an absolutely horrifically devastating epidemic. And during the smallpox outbreak, the Russians were trying to offer inoculations against smallpox. But because of all of the horrific things that Russians had been doing to Tlingit people were hesitant to accept Russian medicine, were hesitant to really accept any help from the Russians because they hadn't really been given any reason to believe that the Russians were trying to help them or trying to do anything good for them in any way. And one of the key reasons here is that Russians had been systematically sexually assaulting and kidnapping Tlingit women, inflicting violence on Tlingit villages and camps, and attempting to steal land. And so again, Tlingit people were understandably very hesitant to accept any sort of inoculation against smallpox. But, we've all lived through the COVID-19 pandemic, and to try and think of death on this scale is absolutely horrifying. And as more of their community started dying from these colonially imported infectious diseases, Tlingit people gradually began to receive the smallpox vaccine, to actually go to the Russians and say, yes, we'd like to receive this vaccine. And the reason they did this was basically because they noticed more Tlingit people were dying than Russian people were dying. It's really interesting isn't quite the right word because it's very upsetting. But it's one thing that's very telling is to see how the Russians were describing this interaction. So, shoot, I'm trying to minimize this thing so I can read this whole quote. Okay, that'll have to do. So this is from the journals of this Russian Orthodox priest, Ioan Veniaminov, who wrote, quote, "One must, in all fairness, consider the appearance of smallpox in the year 1835 the most important epoch in Koloshi history." Koloshi is a Russian slur for Tlingit people. This period is the borderline, the verge, at which the dominance of coarse ignorance and savagery ended, and the dawn of their enlightenment and humanness has begun. Thus, their enlightenment with the light of Christianity is much more feasible now than it was before. The main obstacle of this among the Koloshi was and will be for some time their shamans and old people. But their faith in shamans had been shaken off, and the majority of the oldsters had been carried off by the very same smallpox. There's really a lot to unpack in this quote. One of the things, of course, that's most striking is this Russian Orthodox priest describing the smallpox epidemic as in any way positive, right? He is essentially writing here that the smallpox epidemic would be positive because more Tlingit people would be accepting Christianity. And in other places is saying that now that Tlingit people are trusting Russian medicine, they're going to start trusting Russians more, and essentially says that this is going to be the step and kind of the end of Tlingit cultural spiritual practices. This is going to be really the end of Tlingit sovereignty, was essentially what he was writing. Because he was saying that now that Tlingit folks are accepting the vaccines, they're going to understand that the Russians, quote unquote, should rule them. And so Veniaminov and other Russian colonizers again saw these vaccines as a material manifestation of their supposed superiority over Tlingit people. And they understood diseases as a marker of difference between whites, who are first describing themselves as Russians or Europeans, but in the 1850s begin to describe themselves increasingly as white. They understood these infectious diseases to be a marker of difference between whites and Tlingit people. Some Russian colonial officials basically say things like these outbreaks of infectious diseases, quote unquote, inevitably happened when a quote unquote uh, civilized group of people comes into contact with a quote unquote less civilized group of people. And as was mentioned in that last quote, they also saw vaccines as important for a spiritual battle between Russian Orthodox Christianity and Tlingit spirituality. Veniaminov writes really extensively about how he's frustrated that instead of listening to the Russians, Tlingit people are listening to leaders in their own communities, listening to elders in their own communities, listening to Tlingit spiritual leaders as well. And again, Veniaminov thought that now that Tlingit people were beginning to trust really just this one tiny piece of Russian medicine, he thought that meant that Tlingit spiritual practices were going to be totally over. He writes about this being as like the end of Tlingit shamanism, which is absolutely not the case. Tlingit spiritual practices still continue to this day. And so again, Russian colonizers viewed vaccines as introducing this small component of Russia's supposed superiority that would facilitate Tlingit people's acceptance of colonial rule. And so in this way, the Russians saw themselves as inoculating Tlingit people with whiteness. But again, at the same time, these vaccines would not have been necessary if colonizers hadn't come to Alaska in the first place. And vaccines became something of a tool for preserving Tlingit lives during colonial expansion, again, because colonizers were bringing so many horrific diseases with them, essentially because European hygiene was incredibly poor, so there were a lot of diseases that emerged in Europe. And so again, in this way, these vaccines also inoculated against whiteness, inoculated against this increased settler colonial expansion. And so in 1867, Russia sells Alaska to the United States. Interestingly enough, this is partially because Russia was starting to lose a war in Crimea, which Russia invaded in 2014. And Russia starts to see Alaska as more of a liability than an asset. St. Petersburg and Alaska are really just eons away from each other. To give you an example of how far apart they were, there was one point when a Russian naval boat sank, and the Russian administration didn't actually hear about it for 5 years. So it was really incredibly expensive for the Russians to continue to have a colonial outpost in Alaska. And so they also saw that the United States was becoming more powerful, and the Tsar at the time wanted to make allies out of the United States, and so offered to sell Alaska to the United States. Of course, without discussing this with any of the indigenous people of Alaska, they were not consulted in this process whatsoever. So Euro-Americans take over around 1867, and generally, Euro-Americans were less concerned than the Russians were about the well-being of Tlingit people, which obviously is a very, very, very low bar. And so when there are outbreaks of infectious diseases, what you see happen is, for instance, a naval captain who was in charge of the town of Sitka shortly after the Alaska Purchase tells everyone in town to quarantine except for the indigenous people, who he says have to continue working on American boats. There is a smallpox outbreak in the early 1900s where the governor at the time decides to send all of the Tlingit people who have smallpox or who are even expected of having smallpox to a neighboring island that had no resources, where the majority of the people that he sent there died from exposure rather than dying from smallpox. And even during the flu pandemic in 1918-1919, Shakakuni recalled during an Alaska Native Brotherhood meeting that the territorial government did basically nothing to slow the spread of influenza during the flu pandemic. But what really struck me about Shakakuni's writing is partially that there is a lot of optimism in his writing, despite these horrific things that Shakakuni experienced and was living through. He was very optimistic that basically Tlingit political organization was going to be able to improve things. He was very proud of the fact that the Alaska Native Brotherhood had actually been trying to have legal arguments with the state for quite a long time, doing things like, for instance, the state was supposed to provide some sort of monetary relief to people whose parents or spouses had died during the flu pandemic, and the state never actually started handing that money out. So the Alaska Native Brotherhood went to the state to start demanding that money. And during this period, when we see these outbreaks of infectious diseases, we see the Euro-American colonizers speaking in much the same way that the Russian colonizers did, is they're seeing these diseases as marks of difference between the populations. The Euro-Americans, just like the Russians, are even seeing the difference in fatalities as proof as their supposed superiority. They're saying, well, fewer of us are dying, therefore we are biologically better. And right, this completely ignores the horrific violence of settler colonialism and so many other historical and political factors that were at play. And when Presbyterians came to Alaska, they start to talk about these outbreaks of infectious diseases and the difference in rates of death during these infectious diseases. And the architects of Alaska residential boarding schools start to say that one of the reasons that they thought that they should take children away from their families was because they thought that Tlingit parents weren't teaching their children appropriate hygiene, and that was why infectious diseases were spreading. So these outbreaks of infectious diseases were also kind of a key argument in the creation of Alaska Native boarding schools. And they even, during this time, were forcibly taking Tlingit people from their traditional houses because the Euro-Americans were saying that it was even these houses, the way that their clan houses were structured, were what led, to more outbreaks of infectious diseases. And you'll see a picture here on the right. These are the homes that they were moving Tlingit people into. They thought that these homes, they called them Victorian-style cottages, were more moral, more hygienic. They were focused around the nuclear family instead of Tlingit kinship structure. They basically were doing this to attempt to completely break Tlingit society. But again, one of the justifications they're using is these outbreaks of infectious diseases, saying if we move Tlingit people into these homes, there aren't going to be as many infectious disease outbreaks. And settler colonial public health officials like William Ramsey, who was a doctor at the Alaska Bureau of Education, was making these same biological arguments, saying that influenza was more common among Alaska Natives because they are quote unquote a primitive race and quote unquote have less resistance. And again, so he continues to see these diseases as a marker of racial difference. The next really big outbreak of an infectious disease that we see in Alaska starts to happen in the 1940s and the 1960s with tuberculosis. I can't really appropriately highlight how prevalent the memory of tuberculosis is in Alaska. Everyone I spoke with, whether they were indigenous or a settler, basically had a family member who at one point was in a tuberculosis sanatorium or who had gotten sick with tuberculosis. The rates of tuberculosis in Alaska were 8 to 11 times higher than the rates of tuberculosis in the continental US. And tuberculosis disproportionately affected Indigenous Alaskans. And at this time, the Alaskan territorial governor started to write to, for instance, the Red Cross, to the Federal Security Administration, asking for money to combat these outbreaks of infectious diseases. And what's really interesting and horrifying in the letters of this governor is that he's essentially saying that the Federal Security Administration should send money to Alaska because Alaska is very strategically important and because Alaska had one of the highest rates of military service in the country at the time. So this governor basically says, if you don't start giving us money to combat the tuberculosis outbreak, more white people are going to get sick. They aren't going to be able to fight in the military. And then Alaska's strategic importance might wane or be at risk. And so, again, his explanation is not, let's try and save the lives of these people who the colonial government had absolutely devastated. He's saying that they should give them money because of the high military service in Alaska, and because of the state's strategic importance. And around this time, Alaska public health officials are writing that tuberculosis spread because of quote unquote unsafe water, careless waste disposal, crowded and inadequate housing, combined with rigorous climatic conditions and lack of economic security. I'm not including this quote to say that this was actually the case. I'm including this quote to show that this is the perspective of Euro-American colonizers. There are a lot of interesting and horrifying things that happen as Euro-Americans and Russians both were writing about supposed like cleanliness and hygiene habits. But what's interesting is they also repeatedly say that the cleanliness and hygiene habits are basically the same between white settlers and Tlingit people, except for Tlingit people were taking daily sea baths, which the Europeans weren't. So they're basically trying to find any reason they can to blame indigenous people themselves for the outbreaks of infectious diseases, rather than understanding it was settler colonialism itself that had brought those infectious diseases. And during the tuberculosis outbreak, a report on Alaska's health noted that before 1945, quote, neither the federal nor territorial governments had provided more than a modicum of care for the tuberculosis, unquote. So even this public health report that came out at the time is saying that the government is basically doing nothing to help indigenous people in Alaska. Before I go into this next slide, I want to warn that this I'm going to talk about medical experimentation a little bit. So at the time, there was really no available vaccine for tuberculosis. Treatment for tuberculosis took an incredibly long time. And many tuberculosis sanitariums, like this one on the right, this is actually the one in Sitka that is today still a hospital. All of these sanitariums across the state fill up really, really quickly. And so, again, officials start to get more concerned about tuberculosis. And so this Dr. Joseph Aronson, who was a physician at the University of Philadelphia, wanted to test whether the BCG vaccine, which is still the vaccine for tuberculosis today, whether that vaccine would be effective, because at the time, no one knew whether the vaccine was effective. And so he came up with this experiment. He surveyed heavily in Southeast Alaska, and basically forcibly enrolled thousands of indigenous people in Southeast Alaska and also in other states across the country in an experiment to test whether the tuberculosis vaccine was actually effective. And he himself mentions that he picked areas where, quote, economic conditions were uniformly low, housing was poor and crowded, and morbidity and mortality from tuberculosis were reported as high, unquote. So he's basically mentioning that he's targeting the most vulnerable populations that he possibly can, that he, again, forcibly enrolls in this vaccine experiment. There's a lot that's incredibly distressing about this. And one of the things was when I was reading this article, which is very proudly talking about this experiment as if it was some really fantastic achievement, you try and look at where they were enrolling participants. And you see that they kind of have this catch-all category that includes residential boarding schools. And then you go to look at the ages of participants, and you see that almost every single person in this experiment was under the age of 18. The majority of them were minors. There were a couple of folks who were over the age of 18, but majority children. And there's no mention of consent whatsoever. As a matter of fact, when he writes about going to different villages in Southeast Alaska, he mentions something like white people only voluntarily participated, right? Which, of course, means that they were coercing and forcing Indigenous people to participate in this experiment. So the vaccine was ultimately found to be effective. Again, this is still a vaccine we use to this day for tuberculosis. But only about 2,000 to 3,000 people in Alaska actually received this vaccine. And shortly after they found that this vaccine was effective, public health officials stopped administering the vaccine when tuberculosis rates were still 1,500 per 100,000 Alaska natives, compared to 300 per 100,000 among Alaska's total population. So again, they're testing this vaccine on Indigenous people, but then they aren't even administering this vaccine to Indigenous people once they found out that it was effective. And so, in effect, the government saw Indigenous lives as expendable when knowledge generated from their death could help to prolong white lives, right? Because they create this vaccine, and this vaccine isn't made available to Indigenous people. It's primarily white folks who are getting it. And these researchers, again, that you read this article, and they're not remotely ashamed of what they did. They're talking about this experiment as a great success. And so the loss of the lives of people in this experiment, including people who were given the placebo, so people who they potentially could have saved from tuberculosis but died, the loss of these lives was acceptable because it was producing medical knowledge that could be used to preserve white lives. Again, many of the people in the experiment who were not given the vaccine died from tuberculosis. And so here, when we want to talk about sort of the structures of whiteness at play, we say that whiteness constructed itself as that which has medical knowledge and has an inherent right to conduct medical experiments with Indigenous bodies. And so at this time, this vaccine is inoculating whiteness in the sense that it reinforced a racial hierarchy that placed whites above Indigenous people. The vaccine instilled racial quote unquote discipline. This is sort of a term, like an academic term, by marking Indigenous lives as expendable. And so I think I'm running a little bit over, so I'll try and go about this quickly. I wanted to really highlight the fact that I wanted to highlight the resilience of Indigenous folks during the COVID-19 pandemic and of Alaska Native leadership. And I'm going to do that more in just a couple of slides. But the state of Alaska actually was kind of unique during the pandemic in that the state of Alaska was allocating 1/3 of all the COVID-19 vaccines they received for Indigenous people. But this history of racial denigration, medical abuse, obviously made many Tlingit people I spoke with hesitant to get vaccinated. And so again, we see really across the country that this history of settler colonial violence and medical abuse means that many Indigenous people, many people of color in the United States are skeptical of medicine and hesitant to trust medical professionals. A lot of the Tlingit people I spoke with saw themselves stuck between a rock and a hard place, essentially, having to choose to trust the medical establishment and receive a COVID vaccine. They had to weigh that against also wanting to protect elders and children in their community. But again, they felt like it wasn't safe to trust the vaccine given this horrific history. And so one of the folks I spoke with, Anatsiz, said, quote, "What I know about Indian Health Service is that natives have been test subjects. If you're going to test this, then test it on a white population." And this was a common refrain that I heard among folks. And just for, I have this person's Tlingit name first, Lech Anatsiz, his English name, Tommy Gamble, then their moiety, Yech, which means raven, the raven moiety, and then in the Kiksadi clan. So I'm having their introduction so that they're more properly introduced in like a Tlingit cultural context. And so one Tlingit elder that I spoke with about vaccines was telling me about her mother's experience in residential boarding schools and was talking about abuses that the boarding school inflicted on her mother's doing medical procedure or on her mother doing medical procedures with no justification. And this, of course, made her hesitant to get vaccinated. She felt hesitant to trust medical professionals as a whole. And she told me that, quote, public health policies during pandemics in the past has created an internal distrust of policies, procedures, and people trying to tell me what to do with my own body and other people's bodies. And is something so strongly rooted, this mistrust, not because I've read it in a book, but because my ancestors had shortened lives or didn't even exist, potential ancestors, because of the pandemics that they went through. And this elder, like many other Tlingit folks I spoke with, again, felt they were stuck between a rock and a hard place. This elder had underlying health conditions that meant if she got COVID-19, it could be incredibly serious. But she was concerned that this was another instance of the government trying to medically experiment on Indigenous people. She was worried that getting the COVID-19 vaccine could be riskier than not getting it. So she feared that this vaccine would continue to inoculate whiteness by continuing this history of medical experimentation on Indigenous people. And so again, I really want to highlight the resilience of Alaska Native folks during COVID-19. In Sitka, despite it being rural Alaska, an island in the middle of the Pacific, people in Sitka had access to vaccines really before many others in the US did. I was able to get my first shot of the COVID vaccine in like January 2021, very, very early. Basically, this was because the Alaska Native healthcare system was so robust and was doing such a phenomenal job at making sure people were getting vaccinated that across a lot of Alaska, it was fairly easy to get vaccinated early on in the pandemic. And by January 8th, 2021, so this is, maybe a month, maybe not even a month after vaccines became available, almost 1 in 7 people living in Sitka had received 1 dose of an mRNA vaccine. And by July 2021, 69% of residents aged 12 and up were fully vaccinated. And this is for all people living in Sitka. And again, this essentially happened because of Alaska Native health organizations, like this one Southeast Alaska Regional Health Consortium, because they were providing vaccines to all residents. They did not restrict doses to tribal citizens. They, of course, made sure tribal citizens were getting vaccinated first, but then they were very, very generous with basically vaccinating entire communities. And throughout the COVID pandemic, Sitka Tribe of Alaska had been prioritizing aid to elders, making sure that elders in town had iPads so they could stay connected when everyone was locked down, giving out air purifiers, making sure that people basically had everything they could to be safely in their home, delivering groceries to elders. And Alaska was a very unique place to be during the pandemic for a number of reasons, mostly because of the politics of Alaska. And while in some states mask mandates were a thing, in Alaska, they really weren't ever a thing at a statewide level. It was pretty much up to individual cities to decide whether or not to institute things like this. And Sitka Tribe of Alaska urged the city of Sitka to adopt a masking mandate during a really bad surge of the Delta variant in July 2021. And the only Tlingit member of Sitka City Council, Katyeki, Crystal Duncan, introduced a bill for a mask mandate during times of high transmission. So whenever transmission was at high or very high, it was required that folks wear masks indoors. And this was a really well-timed bill because at one point in June and July of 2021, Sitka had the highest per capita rate of COVID infection in the entire country. And so again, I really want to highlight the incredible difference that Alaska Native and Tlingit leadership made during the pandemic and how really successful their public health efforts were. And I want to leave y'all with this really profound thing that an anonymous elder in Sitka said to me. And this was speaking about pandemics, surviving pandemics over time. He said to me, quote, "I look at the stories of our ancestors and even the stories of the ones who are still here, what they did to get through pandemics. I look at them as stories of hope and of survival. My ancestors made it through all of these pandemics. Your ancestors made it through pandemics of the past. Every nation out there has had pandemics in their past, which they survived. It's why we're here today. Every nation, every group of people has a story of hope and survival somewhere in their past. They survived pandemics, they survived political upheavals, they survived climate change, they survived natural disasters of every kind. They have stories of hope and survival. Just look at people around you. When I see them wearing a mask, socially distancing, they're becoming that story, that hope for survival. Long after we're gone, stories will come telling of how we survived this. This pandemic will be a memory one day, will be a memory one day, and will be that story of hope and survival for future generations." And so, in conclusion, we really see this relationship between vaccines and settler colonialism changing over time. Russian colonizers saw themselves as inoculating Tlingit people with a small component of European culture that they thought would lead to Tlingit acceptance of Russian rule. But again, these vaccines were really only necessary because of settler colonialism in the first place. During the tuberculosis epidemic, Euro-American doctors experimented on Alaska Natives and other indigenous people to test the efficacy of this vaccine. Vaccines became a tool for reinforcing and enforcing racial hierarchy. They inoculated whiteness in a different way. And at the height of the COVID-19 pandemic, many Tlingit people I spoke with in Sitka were hesitant to get vaccinated because of the history of medical abuses. They feared that the vaccines would again inoculate whiteness as a form of racialized violence and control. And the message that I really take from this, particularly for folks who are healthcare professionals or in public health, or honestly, really just any non-Indigenous people generally, responsibly and holistically responding to outbreaks of infectious diseases is going to require sincere and honest engagement with the abuse of passive medical institutions and professionals. Not doing so, trying to pretend that these horrific things didn't happen, is only going to decrease trust and continue to widen this gap between Indigenous people and people of color and medical professionals. So here are some references. Just want to say thank you all so much. In Tlingit, it's Gunachchish. Thank you all so much for letting me talk tonight. I'm looking forward to answering your questions.
Thank you so much, Adam. That was so moving, and I see and heard so many similarities to what different peoples have been going through over a great deal of time, with these past things that have happened medically, dealing with governments, and through today's pandemic. We have some questions that have already come in during registration, and I'd like to let everybody know there's a Q&A box down at the bottom. If you have any questions, please put your questions down in the Q&A box. Our first question is, what guidance do you have for white settlers living and working on stolen land, especially those who are earth folk healers?
I think really my main message for other white settlers is do everything that you can to support and uplift Indigenous sovereignty. If you're recognizing that we are living on stolen land, that means we need to do what we can do to restore Indigenous sovereignty and to right the wrongs of the past. So one of the best ways to do this is to start going to community events, reach out to communities, and really try and build those neighborly relationships with people. I think just really spending time and very, very much taking seriously what Indigenous folks are telling you and the things that they're asking you for help with will go a really long way in doing that. I hope that's helpful.
Yes, thank you so much for that. The next question is, what do people most ask of us now to help bring healing to the earth and the peoples?
Mm. I think really just that really radical act of listening to one another is just really, really profoundly powerful and bringing about healing for people, healing for the land. And when I say listening, I don't just mean sort of like hearing. I mean like very genuinely sitting with what people have to say, taking what they're saying very, very seriously. Um, as far as what's asked of us, I really think it's just um, to extend our compassion, to extend our empathy, and to, treat other folks as if they're family because they're part of the same community as the rest of us. So treating folks as family even when they aren't, and building community. Um, I also hope that answered that question.
Yes, that answers that question. And I have one more question that we received in advance, and then we'll take a look and see if anything's coming in the chat box. Are there parallels with Alaska and the Abenaki or possibly other native groups?
I think there definitely are. Um, I think this history, although it's unique and emerges differently in different places and different times, I mean, this history is the history of colonization, the history of settler colonialism. And so I think a lot of the lessons that can be drawn from really from Alaska, from working with indigenous folks in Alaska can be applied in other places. And again, it's important to really consider the local differences. It's important to not think of indigenous folks as a monolith, but to understand like different nations are different nations, different cultures. Um, could you repeat the question one more time? I'm not sure if I answered all of it.
Yeah, sure. It was basically what kind of similarities have you
Mm.
seen? Are there similarities between what happened with the indigenous people in Alaska, possibly the indigenous people here, and in other places?
Mm. I mean, definitely for the purposes of this talk, I think one of the underlying things is that very consistent medical abuse of trust that has a common history across indigenous peoples in the Americas, unfortunately, um, is what white folks have done in the name of medicine to people of color and to indigenous folks.
Mhm. Thank you for that. Okay, next. What brings you to this line of work? What made you inspired you to move in this direction? That's my personal question.
So as you mentioned in the introduction, my grandparents survived attempted genocide. They were in forced labor and concentration camps, my paternal grandparents. And there was a story that my grandma told me growing up that really, really stuck with me. So as they had just escaped the second camp that they were in, and they were fleeing across Hungary, trying to get west, basically to safety. And had no idea where they were. They didn't speak Hungarian, had no idea what to do, where to go. And this Hungarian family just saw them walking around, could see that they needed help, and took them into their house for the night, fed them, gave them food. And my grandma just always talked about that incredible act of kindness and what a positive impact that had on her individually, and then by extension, us as a family. Like, had it not been for that act of kindness, I don't know that I would be here. Um, and so that was what made me want to start doing research that was kind of trying to repay that act of kindness to the world in some way. Um, I really feel like that has helped me have a better understanding of kind of my place in the world as well. Has kind of, hearing about my grandparents' stories really helped me to understand honestly how things could go from okay to horrific really, really quickly. How thin that line is between society sort of functioning normally and horrific things happening, and really made me want to try to work to build a sense of community. To a much lesser extent, I like visiting new places, but that isn't necessarily like a driving factor.
That's really powerful how much family history can affect the work that we even do into the present and into the future. Um, okay, I'm turning back to the chat box. Uh, Thank you very much, Dr. Kersch. That was very enlightening. I particularly enjoyed the inclusion of cultural practices, herring harvest. Would there be a professional contact address for you?
Yes, it is just my first and last name at iCloud.com.
Thank you. And we have another one. I want to thank Dr. Kersh for their thoughtful, principled, and reflective approach to anthropology. Thank you for breathing love and emotive senses into scholarship.
Thank you, Faith.
Thank you for that. We'll give it another moment to see if any other questions or comments come in. I see some hearts rising. People seem to be very appreciative of the work that you've been doing. Okay. I want to thank you for all of the work that you've been doing for the people in Alaska and also the people here as you sit on the Truth and Reconciliation Commission. And I want to also say thank you to everybody who came here this evening to hear these stories. It's very important for these stories to be witnessed and to be acknowledged that these things have happened. It can, for people to be able to continue to move forward.